Hello, hello, good morning, good afternoon, good evening, internet, wherever you're watching me from. I'm saying good morning, or good afternoon, or good evening, depending on the location where you are watching me from. It is Saturday, second week of January 2024. I believe you guys are enjoying the new year so far. I'm believing things are going to be better than last year, 2023. All right, this is the first program for today. All right, this is the first program for today, and I will be talking about diabetic essentials, mastering all the basics of type 2 diabetes. The topic today is diabetic essentials, help with mastering all the basics of type 2 diabetes, is what we're going to be discussing today. While I'm waiting for, I don't know why I'm waiting this morning. While we are waiting for everybody to join, okay, I'm going to be preparing all my paperwork, the things I'll be discussing today. All right, so invite your friends, colleagues, ask them to subscribe and then join today's morning program. All right, it is 3 minutes past 10 in the morning, my time. So we'll be discussing about diabetic essentials, mastering all the basics of type 2 diabetes. Okay, so I will be delaying a little bit for everybody to join, and then we'll start. So we're gonna wait for a little bit, and then we'll start. And if you have any question ready, just send them in. Just send in your question now to be on the queue, so that I will answer them turn by turn. All right. So if you have any question now, send them in to be on the queue. All right. So later on, 6 p.m. is when we'll do our diabetics fan forum. This one, I'm going to be discussing a specific topic, right? And at the same time, I will take some few questions. So this morning, I'm going to be, if you look at the screen and see the title of today's discussion, program is Diabetic Essentials, Mastering All the Basics of Type 2 Diabetics. Okay, that is what we will be discussing today. And please, if you've not subscribed to my page, if you're not following me yet, kindly do so now. Go to my page, Managing Diabetics TV on Facebook, and subscribe. I have two pages on Facebook. One is Managing Diabetics TV on Facebook and also on YouTube. The same name. I'm on YouTube, Instagram, and Facebook. Managing Diabetics TV on Facebook and the same name on YouTube. And then my second page on Facebook is called Living with Diabetics. Living with Diabetics. Okay. So I run programs on those two pages. Okay. So in case it's my backup page, in case if there's a delay on this page, I can use the backup page and continue. So try to subscribe to those two pages. Go to my Facebook. In Facebook, I have two pages. One is called Managing Diabetes TV, which is this one you are watching me the program now. And then the second page on Facebook is called Living with Diabetics. Living with Diabetics. So try to follow me on those two pages. Okay, subscribe those two pages. And then on YouTube is Managing Diabetics TV. And I'm also on Instagram. All right. So if you are not yet following me, kindly do so. All right, kindly do so. So this morning, usually weekends I discuss a specific topic. Then 6 p.m. today, we're going to be doing the diabetics fan forum. 6 p.m. is today. I'm going to start early. Maybe I'm going to start around 5 p.m. Because by 6 p.m. most people will be asleep, depending on the country where you are. So maybe I'm going to start early today for the diabetics fan forum. Maybe I'm going to start around 4 or 5. Okay. So this morning is the first program, and the topic I will be discussing this morning is specific diabetics essentials, mastering all the basics of type 2 diabetics. Is what we're going to be discussing today. So kindly get your pen and paper in case if you want to write certain things down, you write them down, and also invite your friends also to join the program. Ask your friend to go and follow me on my Facebook page and also in listening to the program. Now, if you have any question, try to send in your question now to be on the queue. On the comment section, send me your question so that because I answer the question turn by turn. So if you are the first, your question is going to be answered first. All right. So I'm just delaying a little bit. I want the number to increase. I want people to join, and then we'll start. Because once I start, some will come later and they want to go back, drop me back to repeat again. So I don't want to repeat. So that is why I'm delaying a little bit before I go into. I don't know why I'm sweating. Despite that we are having a winter now. I don't know why I'm sweating. So I'm just exercising some delays. Okay. Let me make an announcement on my page to let them know that the program is on. I'm trying to remind. I'm trying to see. Okay. All right. Let's start. Let's start. Okay. Abubakar, you are welcome. Welcome, Abubakar. You are welcome. Happy weekend. Flora, you are welcome. Flora is watching from Botswana. You are welcome. Abubakar, you are watching from. Thank you, Abubakar. Abubakar is watching from Zamfara. Zamfara. Okay, Abubakar, your governor was confirmed yesterday by the Supreme Court as the governor of the state. I believe you are happy now. All right. So Abubakar is watching from Zamfara, Nigeria. Welcome. And then Flora is watching from Botswana. You are welcome. All right. So let's get your pen and paper in case if you want to write something. Get your bottle of water. If you don't want to miss anything, get a bottle of water put beside you. Um, and then send in your question now. If you have, let it be on the queue. Okay. So get this thing out. Okay, from the topic, this morning, okay, as you can see on your screen, we'll be discussing diabetic essentials, mastering all the basics of type 2 diabetes. If you have type 2 diabetics, you have to know all the essentials, how to live with it, manage it properly. That is what it's all about. That is diabetic essentials. There are things that you need. Apart from the medication, there are other things that you need in mastering the art of taking care of yourself if you have diabetics. All right? If you have diabetics. Excuse me just a minute. I'm going to step away. I'm going to be right back. I'm going to be right back. Okay. All right. I don't know why I'm sweating this morning. We're in winter. It's cold outside. Don't know why I'm sweating this morning. All right. Okay. Okay. I know why I'm sweating. Just hold on a minute. Let me set. Okay. Now, diabetic essential, what I was saying before. All right. If you are diabetic, if you are a diabetic, great, great, Abaka. All right. All right. Okay. If you are diabetic, okay, if you are diabetic, one thing you have to understand, diabetic is a chronic illness. It has no cure. Said it yesterday program, diabetes has no cure. If it has a cure, I can afford it. Okay, if it has a cure, there are a lot of head of state, president that can afford it. It's like somebody telling you there is a cure for cancer. If there is a cure for cancer, why should the president of Venezuela die of cancer? He has all the money on this earth to buy it and steal it. But at the end of the day, he has to pay the ultimate price. There is no cure for cancer. If you are lucky, they can send it back to remission. If you are one of the luckiest person on earth, yes, you can get rid of it and then live for a longer period of time. There are those that are not lucky to send into remission. It can go into remission and then all of a sudden come back again. And when you come back the second time, you might not even have up to 6, 7 months to live. So it depends. There is no permanent cure for cancer. Because if there's a permanent cure for cancer, a lot of celebrities that have the money who can afford it, all right? If there is cure for cancer, there are presidents, head of state that can afford it. They all die. So if anybody's selling you any concoction on the street, telling you this can cure cancer, you are just enriching that person and paying with your life. Because at the end of the day, you are going to pay the ultimate price while that person is living. The same thing applies to diabetes. Diabetes has no cure. There's a treatment for it, and that treatment is to manage it. Once you are following the rules and regulation, as I was saying, you can live with it, you can manage it properly, and live for a longer period of time. Okay? Everything is, you have to understand the basics. And once you understand diabetes, the rules, the norms governing diabetes, you are going to live, enjoy your life for the rest of your life. Okay? So that is what we're going to be discussing today, mastering all the basics of type 2 diabetes. All right? Mastering all the basics of type 2 diabetes. That is what I titled this topic today, Diabetic Essentials. All right? Now, the topic that I'll be covering under this diabetic essentials, the topic that I'll be covering is blood sugar and A1C. I'm going to list the topic that I'll be covering. Let me just type it. So these are the topics that I'll be covering on this diabetic essential. Okay, these are the topics we're going to be discussing on diabetic essentials, mastering all the basics of type 2 diabetes. Okay, so the first topic is going to be blood sugar and A1C. Okay, so the first subtopic under diabetic essentials is your blood sugar and A1C, and then we'll go to 2, carb counting, and we'll go to 3, low carb eating, and we'll go to number 4, alcohol, and then we'll go to the last one, exercise. These are the topics that I'll be covering on this diabetic essential, mastering the basics of type 2 diabetes. Okay. Denise, you're watching from Dominica. You're welcome. All right, you're welcome. So these are the topic. The first topic under diabetic essential is blood sugar and A1C. Okay. Once I finish that topic 1, we'll go to topic 2, which is carb counting. 3, low carb eating. 4, alcohol, and then 5, exercise. Okay. So this is what I'll be discussing. Now, let me remove this. Now, let's start with topic 1, blood sugar and A1C. We all know what is blood sugar. Okay? We all know what is blood sugar. So we have to talk, you have to know about testing and tracking your blood sugar. So first thing as a diabetic is to know how to test and then track your blood sugar. There's something I forgot. I brought it from the office yesterday. I wanted to use it this morning, and I need it on this topic. Please just exercise less than 1 minute. Let me grab it from my inner office, and I'll come back. Let me grab it from the other office. I'll come back. I need it to discuss on this topic. I can't discuss without it. So just 1 minute. I'll step away. All right, I'm back. Okay, all right. It's good to be back. All right, I have it here now, so I'm going to use it later. All right. The first thing as a diabetic is to know. The first thing as a diabetic is to know how to test your sugar and then track your blood sugar. If you're a diabetic, you have to know how to test your sugar and how to track it. Okay. Now, testing your blood sugar gives you an important information about how you will handle your type 2 diabetes. Not only handle it, how to manage it and how to live with it. Okay. And then your treatment plan. Because when you test your blood sugar, okay, it's going to give you a vital information if your sugar level is high, low, or is it stable. That information is critical in living with it, in managing it, and then fashioning out your treatment plan. Okay? And also, it lets you see how factors such as food, exercise, and medication affect your blood sugar level. Sorry, I'm going to put out this thing. Where do I put this? Okay? So, why should you test your blood sugar level frequently as a diabetic? Is to get the vital information that you need, okay, in the management and living with diabetes, and also your treatment plan. Okay, and let you see how factors such as the food you eat, your exercise, and the medication you take affect your blood sugar levels. All right. So keeping your blood sugar in your target range is the best way to manage your diabetes. You have to make sure. I was saying yesterday in my discussion, you guys have to understand the language. Okay? Keeping your blood sugar level in a target range is the best way to manage your diabetes and reduce the risk of other complications. It did not say you should keep your sugar level today, let it be a little bit lower than the normal range, or tomorrow higher. It has to stay within that target range all the time consistently. If you're living with diabetes, your sugar level must be within the target range consistently, every seconds, every minute, every day, every hour, every day, every month, every year. And when you do it for a period of 2 years consecutively without any changes, that it is called, then they're going to recommend you as that controlled diabetes. A doctor is going to issue a letter that your diabetes is controlled. He might decide to stop giving you medication, say you don't need to be on medication anymore. Continue doing what you are doing. Okay? So you have to make sure that your sugar level is consistently in the target range every second, every minute, every day, every month, every year for 2 years consecutively to be called controlled diabetes, that doctor will take you out of medication, say you don't need it anymore. And by that time, you've mastered the art of managing and living with your diabetes. Okay, because there are certain factors within those 2 years you have found out how the food you eat, the exercises, and the medication affect your sugar levels. So that is the reason why you should test your blood sugar. Okay, now the ones we have now, okay, is this. We all have this in testing our blood sugar levels. You we call it glucometer. We have the glucometer. You peer your finger, take some blood, and put on it. And we have the ones that are. This one is the most cheapest one. Okay, the one use the glucometer. All right. Then there's the one that you put in any part of your body permanently. Okay, and you have to change it every month. Okay, you have to change it every month. You can take a shower with it. You don't need to remove it. And then you program it on your phone. Okay, do you want it to be sending you automatically your sugar range every 30 minutes, every 1 hour, or every 2 hours? You don't need to be piercing your hand anymore. So the way you program it on your phone, on the app, so every 30 minutes, it's going to automatically send your sugar reading on your phone and then keep the record. So you don't need to be writing them down anymore. But that one is more expensive. Okay. So now, why I say I need this, I'm going to bring it out. Just hold on a minute. Okay, this is your logbook. Okay, this is your logbook. All right, we call it a clean log or a logbook. Every diabetic must have this logbook. If you can create one by going and buy an exercise book. Okay, and buy an exercise book. Okay, you can see everything is specified here. Okay, now when you test your sugar level in the morning, first thing in the morning when you wake up, you're supposed to write it down, enter the information on your logbook. Before breakfast, okay, when you've not eaten anything, the time you took it, what is the sugar level, and the date. You have to have this. Every diabetic have to have a cleaning logbook. You have to have at least 2 weeks of your diabetics record with you at all times. Okay, you have to have 2 weeks. It's not a choice, it's a must. Every diabetic have to have this. Now, Why you need to have this is very important, because you leave home all the time. You are not at home all the time. You leave home, you go to work, you go to your offices, you travel. Should there be any emergency on the way, on the road, there's an emergency on the road, you are not at home, you don't have your wife, your husband, or your son, your daughter with you, and there's an emergency, diabetic emergency, and you are rushed, or people come to attend to you. When they see this in your book, because you're going to write your name, your address, your phone number, and then indicate you are diabetic. So people attending to you see this, at least this gives them an idea that, okay, he has any diabetic emergency, he's diabetic or she's diabetic. So they'll be able to know how to help you. Among out of 5, 6 people that come to help you, one must have a knowledge about diabetic. It's okay, he's diabetic, and look, and they'll open the book and see all the information the last time you take your sugar level. So now, not only having your logbook with you, you must also carry your glucometer with you. Carry this with you in your bag. You must have it with you in your bag. So anytime there's an emergency and then you need a help, you fainted or you lost consciousness, with your glucometer with you and somebody saying this will be able to help and take your sugar, your blood, to test your sugar reading immediately. You might not even know what they are doing, but at least that gives them an information that you're diabetic. So when they check your blood sugar reading and they find out that your sugar reading is very, very low, that person should be able to know what to do. That, okay, your sugar reading is very low. That is why you're unconscious. So all they have to do is to go and buy a Coke, buy a Fanta, and give you to drink. And when you drink it, give you about 15 minutes, 20 minutes, your sugar level is going to come up and you'll be okay. And then now you can know where you are. Or if there's an accident and you are rushed to the hospital, this is going to help the hospital to know that this patient is diabetic. So they will know the kind of medication, how to treat you. But in the case where diabetics and you don't have a logbook and there's an emergency out there, that time they are trying to figure out your situation. Every second that passes, your life is in danger. Because you're diabetic. Others might not be diabetic, but you that is diabetic, every second that pass and they're trying to figure out what is your situation, your life is in danger. And that is why you must have your blood cleaner log with you at all times. All right. Now, that is the reason why you should test your blood sugar reading. I'll give you guys the reason why you should test your blood sugar reading. Let me come. I'm going to paste this because I'm going to paste this. I got a test now from one of my fans. I have a couple of fans here that are deaf. They can't hear me, but they can read. So I always try to put the information so that they can read on the screen what I'm saying. So I'm going to post it. Why you should test. Okay. So we are discussing we are discussing the first topic. Okay. We are discussing the first topic, blood sugar and your A1C. That is what we are discussing. So everything that I just said now is what I pasted in the screen. Everything that I just said is what I pasted in the screen there. Okay. Your blood sugar testing, why you should test. Testing your blood sugar gives you an important information about how well your type 2 diabetes management and treatment plan is working. It lets you see how factors such as food, exercise, medication affect your blood sugar levels. And keeping your blood sugar in your target range is the best way to manage your diabetes and reduce the risk of complications. Bring your meter or a log of your result with each time to see your doctor. That will help. All right. So, let's go to how do you test your blood sugar. We all know how you test your blood sugar. Let me remove this now. So, how do you test your blood sugar? Okay, we all know how we test our blood sugar by collecting our blood from our finger, put it on the lancet, Okay, first of all, put the Lancet on the meter. Okay, let it be on. Program it. Is it millimole or milligrams? All right. So choose it depending on the area where you are. You want to set it on millimole per deciliter, or you want to put it on the milligrams. Set it. Put the blood. Now I'm going to repeat this. I think I've done it in one of my videos, but I'm going to repeat it again. I'm going to repeat it again. I've done it in one of my videos. Okay, this is where you this is the lancet you put in the meter to collect your blood. Okay. Now at the bottom here, you see the color. This is where it goes into the meter. This brown, this is it brown or this particular shaded area goes into the meter. All right. And then at the tips here is where you put your blood. This tip here, you can see the way I'm holding it. When you want to test your blood, you make sure your finger does not touch these two areas. This is where you put your blood. You see this arrow here? That's one arrow. Don't let your finger touch it. Otherwise, you're going to get an inaccurate number reading. And also, where this area that goes into your meter, make sure your finger also does not touch it. So these two ends, make sure your finger does not touch it. Because if you touch it, it's going to collect the heat at your skin and might not give you an accurate reading. So make sure when you're collecting your blood, this area where the blood goes, make sure your finger does not touch, and make sure your finger does not touch here. Collect your blood, and then you cannot check. You cannot check your blood reading. So you have to. How do you test your blood sugar level? Is by taking your glucometers, taking your lancet, and collecting your blood samples, and then wait for the result. Okay. First of all, you have to wash your hand. Wash your hand before you start checking for your blood. Wash your hand, insert the strip into the meter, and again use a small needle to pierce your hand and collect the blood samples. And then collect your blood samples and then wait for the reading. And then disposal of those strips. Make sure you dispose it properly because it has your blood samples in it. Make sure you dispose it properly so that another person should not come in contact with the blood. Okay, so when you are disposing the meter, make sure it is disposed, wrap it in a tissue, and then dispose it properly that nobody can come in contact with it. All right, so this is how you collect your blood samples. We all know about that, so I'm not going to go into that. We all know about that. Maser Evalistus, you're watching from Lesotho. You're welcome. You're welcome. So we all know how we collect our blood samples. So okay, so I'm not going to go into that because if you're diabetic by now, you know how to collect your blood samples and check your blood rate. So I'm going to keep moving. Now the next one is how often do you check your blood test if you're diabetic? I'm still on topic 1. I'm still discussing the topic 1, which is blood sugar and A1C. Okay, I'm still on that before we go to the second topic. So how often should you test your blood sugar? Max Mead, you're welcome. Max Mead, you're welcome. Where are you watching me from? So how often should you check your blood sugar? Okay, you're watching from Somalia. You're welcome. You're welcome. Now, on this, how often you check your blood sugar depends on different factors. Checking your blood sugar depends on different factors. There are people that might check their blood sugar every 1 hour, every 2 hours, or every 4 hours. There are factors that you must put into consideration, and then your doctor will determine how often you check your blood sugar. Okay? The medication you take will determine how often you take your blood sugar. Okay, if you are pregnant, will determine how often you check your blood sugar. And how well you are meeting your blood sugar goals will determine how often you check your blood sugar. If you are experiencing low blood sugar without the usual warning signs, will determine how often you check your blood sugar. Okay, so these are the factors that have to be into consideration to say, okay, I'm going to check my blood sugar every 1 hour, every 2 hours, or every 3 hours. So the medication you take, first of all, will determine, should I check my blood sugar every 1 hour or every 2 hours? Am I pregnant? Are you a pregnant lady, pregnant woman? Will determine, should I check my blood sugar every 2 hours or every 1 hour? Now, how well you are meeting your blood sugar goals. Like, I'm going to use myself as an example. Okay. Because for the past 10, 15 years, my blood sugar has been consistent on the target range. It has never gone down, it has never gone high. It's still within the target range. And that is why I belong to the class of controlled diabetics. It's in remission. So I know the things that I'm not going to go near, and I sacrifice it. I say, no, I'm not going to go near it. So now, because I know for the past 10, 15 years, my sugar has within that target range, I'm not going to be checking my sugar level every 2 hours or every 1 hour because I already know that I'm okay. All right. So how often, if you are meeting your target range, if your sugar readings have been consistent for 6 months, getting to a year, you don't need to be checking your sugar reading every 2 hours or every one because you know at the back of your mind that you are controlling your sugar levels. But if you belong to those who that every time their sugar level is high, then you have to be checking your sugar reading every 1 hour or even less than 1 hour. You have to be checking your sugar reading because your sugar reading is always high. Okay. Now, if you're experiencing low blood sugar without any warning sign, then that is a cause for concern to be checking your sugar reading every 20 minutes because you don't want to experience low sugar blood in your system. That is going to send you to another direction and another complication. So these are the factors that will determine how often you check your blood sugar. Suleiman from Tanzania, you're welcome. Zanzibar, you are welcome. All right. I want to visit Zanzibar. I want to visit Zanzibar. I've been hearing a lot of it. Maps from Botswana. Happy New Year. Welcome. Maps. It's over 2 years now. I've seen. The last time I see you is 2021. All of a sudden you disappear. Welcome. All right. So now these are the factors that will determine how often you check your blood sugar. Now I'm coming. Let's do something here. Happy New Year, Maps. So the question is, sorry, I have to correct this. Sorry, I have to correct it. All right. Okay. How often should you test? Okay. And as I was saying, how often you test, when and how often you should test your blood sugar depends on a number of factors, such as which medication you take, if you are pregnant, how well you are meeting your blood sugar goals, if you're experiencing low blood sugar without the usual warning signs. Okay, so those will determine, okay, those will determine when you should check your blood sugar levels. Okay, I'm still discussing, we're still on topic one before I go to topic two. Okay, we're still on blood sugar and A1C. Today's topic is diabetic essential, master all the basics of type 2 diabetes. Okay, now, since you know the factors that determine how often you check your diabetes, let's talk about uh, what time, what are the times to test your blood sugar? What are the times to test your blood sugar? You have to test your blood sugar before and after eating. Before you take your breakfast, take your sugar reading and then write it down before meal or fasting. Then after you finish eating, take your blood sugar reading after 2 hours after you finish eating, which is random. We call it random. Okay. So make sure you take your sugar reading after you finish 2 hours after you finish reading, eating, and then write it down as random. That means you've ate or after meal. Now, before you start your exercise, before you go to the gym or before you start going to the field to play soccer, or you want to take a walk, about 1 kilometer walk, or you want to jog about 1 kilometer, or you want to go for a jogging, take down your blood sugar reading. Time, the number of what is the sugar reading, and then indicate before exercise. And then take your sugar reading after your exercise. After you finishing your exercise, take your sugar reading and you see the difference. That is why exercise is very important. Exercise is a powerful tool in controlling your sugar level. All right. So before and after an exercise, have your sugar reading taken. Now, before you go to bed, the last thing you have to do before you finally go to bed is to take your sugar reading. It's very important. Because remember, when you get up in the morning, you also have to, the first thing you have to do is to take your sugar reading. So before you go to bed, you have to make sure you take your sugar reading and write it down. Okay? Now, more often, if you change your daily routine or your medication, if you change your routine or you miss one, maybe for instance, if you want to take your medication in the morning, check your reading in the morning, your routine is going to change. Okay? Now you miss one, your routine is going to change. Or there's a change in your medication. Because when there's a change in your medication, you see that your sugar reading is going to change. Because now your sugar reading is going to be working towards, first of all, it's going to take about 5 days for your new drugs to take effect. Because in your system already, the previous drug, for instance, if you're metformin, okay, and you are getting side effects of metformin and you don't want to change it to another drug, and then you start taking the new drug is going to kick in 5 days from the day you start taking it, because in your system, you still have metformin. Okay, so as soon as that new drug changes and take effect, you see that your blood sugar reading is going to change. Compared to when you are taking metformin and then the new drugs. So your medication will also change. Your medication will also determine what time you take your sugar reading. Okay, so I'm going to indicate it there. Common times So the common times to test your blood sugar include 1, before and after you eat; 2, before and after your exercise; 3, before you go to sleep; 4, more often if you change your daily routine or your medications. Okay. Your doctor can also help to develop a testing routine for you. Your doctor can also help you. Your doctor can also help you to develop depending on other factors. Now let's go to. I'm still on topic 1. Let's go to target blood sugar ranges. The range you should keep your sugar range target is what we are going to discuss now. Let me get this thing out here. Somebody asked me a question here. Max me, my name is Mohammed. If I have diabetics more than 15 years, which best drug to take? Max me. Okay, there are thousands of diabetics drugs that treat diabetics. Now, one thing you have to understand is that every doctor have a different medication they use. Every doctor don't use the same drugs. But let me give you guys a secret about doctors. It's something that is this. I'm not even supposed to say it, but let me just say it. That is what we do. Okay, there are thousands of different medications to treat diabetics. The same doctor don't use the same medication. Dr. A might use a different medication, Dr. B might use a different medication, and there's a reason for it. You see, this pharmaceutical industry, these pharmaceutical industries, they are multi-billion-dollar industries. So for them to push their drug to be sold, they have to go and scratch the back of the doctors. They have the list of all the doctors. They send marketers to go to their doctor's office and tell them, if you recommend this drug, for every drug you recommend to these patients, you're going to get this how many percentage. So they have to pay the doctor to keep recommending their diabetes drugs to you. So that is why you see, even if you go to a doctor A, say, doctor, my friend is using a different medication. Can I bring it? The doctor is going to tell you no, because that pharmaceutical industry is not paying him to recommend those drugs. It's allowed. It's not illegal. It's allowed. It's competition, because there are a lot of industries that are producing diabetic drugs. So they have all the doctors' lists. So they send marketers to go to doctor's office to say, the more you push our drug out, for every drug you prescribe to this patient, this is how much you're going to get. So that is why doctors remain on one drug. So if you go and bring another drug to that doctor, he's not going to say no. He will tell you, oh, that drug is not good. It's not that drug is not good. That drug is good, but because he's not going to tell you the reason why he doesn't want to recommend that drug. Because why should he recommend that drug when he's not been paid by that company to recommend those drugs? So that's what doctors do. So that is a secret that you guys are not supposed to know. So all these pharmaceutical industries, there are competitions to sell their drug. And how can you sell your drug? Is through doctors. Okay? So they have to go and consult the doctor. Doctor, we have this. It's approved by the government. We want you to help us to push those drugs out. So doctors now start recommending those drugs. Okay? If you have a side effect on that particular drug, they will go to the next company that also pays them. But if that drug you are bringing from the other doctor to you, they will say no, because that company is not paying them to recommend those drugs. So even though that drug is approved and is good, but he's not going to give it to you because this company is paying him to push those drugs. So why would he go and prescribe that drug when he's not being paid? It's legal, it's not illegal. That's how these pharmaceutical companies push their drugs. So there are thousands of drugs for diabetics. The drug that I might recommend to you might not be what your doctor is going to recommend to you. So he's telling no. And one thing again, I noticed why I cannot recommend some of these drugs. There are some certain drugs that we use in North America here. It's not even in Africa. You can't find them in Africa. Because these drugs here, nobody can afford it in Africa. It's too expensive. So that is why you see in African countries, diabetes medication is more, there's a drug specifically for African countries. Because they know per capita living there is very low. So they will not like to push drugs that are too expensive to Africa where nobody can afford it. So that is why they send those cheaper drugs. And maybe those cheaper drugs might not work effectively to the drugs in Western countries here. But because of the affordability, they try to send the cheaper drugs there where people can afford it. But it might not work properly the way drugs in Western country that is going to work properly for you. So there are drugs that I can recommend here that you cannot find it in your country there because it's too expensive. So that is why I'm going to advise you is that since you are working with a doctor for 15 years, if you have any problem with that medication, go back to the doctor. I'm having side effects on this medication or it's not working properly. Can you recommend me to another drug? The doctor is going to recommend you another drug. It's allowed. Okay, there are thousands of drugs for diabetes. Okay, but the most important thing is not about drugs that you take. It's not about the drugs that you take. The question is that you don't even need drugs to control your diabetes. There are other things you can do to control your diabetes. If you are managing your diet very well, eating healthy, balanced diet, and again, you're exercising and then reducing your weight, you can effectively manage your diabetes without even depending on drugs. So you might be taking drugs for 15 years and see that you are not getting results. But the question you are going to ask yourself, why am I taking drugs for 15 years? And now you are blaming that drug not working properly. It's not the drug. If your diabetes for 15 years is not working properly, don't blame the drug. It's not the drug. You might be taking a very good drug, but there is something you are doing that makes that drug not work properly, that makes for you not to control your sugar level. It is your diet. The kinds of food you eat makes that drug not to work effectively for you not to control your sugar level. So you might take your drug for 20 years for eternity. If you don't change your diet, if you don't eat properly, your sugar level is going to keep really high. So it's not all about drug, it's the dieting aspect that is very, very difficult. So you have to change your diet and eat healthy for that medication to work effectively. Max, I believe I've answered your question. So you got to change your drugs. You got to change your dieting, and then gain exercise and then reduce your weight and then stop taking alcohol. All right. So don't blame it on the drug solely because if I say I'm taking drug for 15 years, but my sugar reading is always high. Why? And you are blaming it on it's not the drug, it is the thing that you are eating that is causing your sugar level to be continuously high, that drug is not working effectively. So for your drug to work effectively, you have to change and eat healthy for it to work. And if I ask you what you eat, if I say, Max Smith, what did you eat last night? Now, if I say, what did you eat last night? Can you tell me what you eat last night? I'm going to tell you why your sugar reading is not working. It's not. Can you tell me what you eat last night? Max Smith, tell me what you ate last night. I'm used metformin more than 15 years. Is there any effect on me? Every medication had a side effect, but it depends on the severity of the effect. There are some effects that are minor, and there are effects that are major. And there are some effects that you cannot even, there's no symptom, you cannot even feel it. So it depends on the severity, and it depends on the underlying illness that you have. So every medication has an effect. But it depends on the propensity of the severity of that side effect that the doctor might recommend to change it. So metformin, I'm not going to just say metformin, every drug you take have some side effect. Does metformin have a side effect? Yes. But it depends on individual. There are some individuals who say metformin is working for me. And some individuals tell you, oh, metformin is not working for me. Okay. I have a patient that comes in and say, you know what, doctor, I'm having a erectile problem. It's like this metformin is making me not to have an erection. I'm having difficulty satisfying my wife. You know, what is the situation? I look at him, I say, listen, metformin, I hear that my friend is telling me that metformin can make you have an erectile dysfunction. I say, and that is why I said to people, lack of knowledge. People die because of lack of knowledge. As I was looking at him, so when he finished talking, I said, hey, listen, metformin is not the cause of your erectile problem. Your nerves are damaged. I said, before you have an erection. I said, yes. I said, your nerves are damaged. So what damaged my nerves? I said, because your sugar is too high. You are not controlling your sugar, and the sugar is damaging your nerves. You are lucky that you are not blind. You should have been blind by now. So you are lucky that he went and damaged your nerves, and that you can't have an erection. What if you wake up tomorrow morning and you cannot see? As I'm talking to you now, your sugar already is damaging the nerves, your retina. Don't be surprised you go to bed and wake up blind. So you have to control your sugar level. And now that you're having a erectile problem, the nerves are damaged and cannot be reversed. So you have to live with it. You got to use Viagra, you got to use Cialis in order to get an erection. But for now that you cannot have an erection for more than even up to a minute, sorry, that's the situation because you allow your sugar to get hold of you. So your sugar damage your nerves. You are lucky that it goes to your erector. It does not even cause you to go blind. There are people that just go to they go to sleep, they can see. They wake up in the morning, they are blind because the nerve have been completely damaged because you are not controlling your sugar level. So it's not metformin. So I advise him to go and control your sugar level before the next thing is going to happen. Now you're going to go blind. Okay, so metformin has effect, but it depends on individual. The severity depends on individual, and then there are people that might have it minor, major, or there's no symptoms. But metformin is a good drug. But metformin might not be the issue why your sugar level is not controlled for the past 15 years. You have to watch your diet, Max Mill. I believe I've answered your question. So let's continue our topic. Let's discuss about your target blood sugar ranges. Okay, let's discuss about your target blood sugar ranges. Okay. Now we all know yesterday, I said yesterday in the forum, diabetes forum, that if your sugar level goes to 600 milligram per deciliter, that is you are in the danger zone. That is what we call diabetes emergency. You are experiencing the coma. You are in the coma range. That is the worst reading you can have. If your sugar reading is about 600 milligram per deciliter, that is you are in the final stage. You are in diabetic emergency. The worst reading you can ever have, that you can die at any point in time. So let's go to the target blood sugar ranges. Okay. Let's go to the target blood sugar ranges. In general, target blood sugar ranges for someone with type 2 diabetes are, okay, if you have type 2 diabetes, okay, your blood sugar ranges for someone with type 2 diabetes are, excuse me, somebody, I'm gonna, just a minute, somebody send me a question now that I need to. Please, Tony, I got your email now. I'm on a live video. I'm gonna give you a quick, I'm gonna send you a quick email, but please, you gotta wait for me to finish the live video and then I'm gonna respond. Those that are sending me message on WhatsApp, Tony, Tony, check your email in the next minute. I'm doing it right away now. I'm doing it right away. I've sent it, Tony. I've said check your email. All right. So if you have type 2 diabetes, your target sugar ranges. I want you guys to write it down. So when you're checking your blood sugar, because I know I'm going to get a question on this. You know, I always get a question on carbohydrate and then sugar ranges. Most people, because they are always confused on that particular aspect. If you have type 2 diabetes, your sugar range before meal before meal is 80 to 130 milligram per deciliter. Okay, 80 please look at it. I put it on the screen. It's scrolling. Okay, it is scrolling at the bottom of the screen. You can see it scrolling at the bottom of the screen. Okay, if the target blood sugar ranges for somebody with type 2 diabetics, okay, before meal is 80 to 130 milligram per deciliter. Okay, which is about, that 80 is about 4.4 millimole per liter. So 80 is about 4.4, and then 130 is about 7.2. Okay, if I convert it to millimole per liter, okay, if I convert 130 milligram per deciliter into millimole per liter, is 7.2 millimole per liter. For those that are in the Western country, if you are in other countries like Africa, we are using a milligram per deciliter, which is about 80 to 130 milligram per deciliter. So if you convert it for those that are in North America, where other European countries, they use millimole per liter. So when I convert this 80 to 130 milligram, so 80 is about 4.4 millimole per liter, 130 is about 7.2 millimole per liter. So your blood range is supposed to be between 80 to 130 milligram per deciliter for those that have type 2 diabetes before meal. Before meal. Okay? Before meal. Now, after meal, after you finish eating, 2 hours, 1 to 2 hours after you finish eating, your blood sugar should be about less than 180 milligram per deciliter. Okay, 1 to 2 hours after you finish eating, your sugar reading is supposed to be less than 180 milligram per deciliter. Okay, which is about 10 millimole per liter. Okay, so 1 to 2 hours after eating, if you have type 2 diabetics, your sugar should be less than 180 milligram per deciliter. Okay. So 2 hours after you finish eating, 1 to 2 hours after beginning of the meal, okay, it should be 180 milligram per deciliter, which is about 10 millimole per liter. That is your sugar range. Okay, then your doctor, depending on the other underlying illnesses that you have, if you have cholesterol, if you have high blood pressure, if you have other illnesses, okay, your blood sugar range target, your doctor will not set a blood sugar range for you. So if you have other complications, if you have other illnesses apart from diabetics, then your sugar rate might be different. It's like somebody that is 65. If you are 65, 70, 80, 90, your sugar range is going to be different from somebody who is 30 years old. So, so your doctor will recommend a different target for you depending if you have other underlying illnesses. Okay, so there's other factors to take. One is your age, how long you've had how long that you have type 2 diabetics, whether you have any diabetes complications, other condition that you may have, or overall health condition. So these are the things a doctor will not specify for you specifically that your sugar range is supposed to be this, different from what I just mentioned. Putting into consideration your age, how long you have type 2 diabetics, do you have any underlying illnesses, do you have any complication from diabetics, then your doctor will specifically set a target range for you. All right. So we are still on topic 1. Okay. Now we're going to be moving to topic 2 now. Okay. Okay. So now we're going to be moving to topic 2. Somebody, let me see who is online for me. If I have diabetes, doctor, which best food to take and vegetables? You are taking a different topic now. Okay. Yesterday we discussed about it. Which best food to take? Okay. Which best food to take and vegetables? The food you have to take. Okay. You have to take food that are rich in fiber and less carb. If you are going to eat, you're going to eat less food that have less concentration of carbs, carbohydrate, and eat more fiber. So what do I mean less carb? Maxwell, you got to wait because I'm going to discuss about that. I'm going to keep your question. Okay. I'm going to keep your question because it's part of the topic. When I'm going to be discussing carbohydrate, low carb, I'll answer your question. So just it's among the topic. I don't want to discuss it now because I'm going to that area. It's among the 5 topics we're going to discuss. So your question, I'm going to answer it when we reach the turn of low carb eating. Then I'll answer your question. All right. So be patient. Just stick to the program. We have another 1 hour to go. All right. Okay. Evaristo says all is progressing well. That is good. So Max Mead, you got to be patient. We're going to be discussing it later. So the final on this topic of sugar, blood sugar, and A1C is you have to choose the right meter. Make sure your glucometer is functioning properly. Choosing the right meter is good. Okay, don't go for the cheaper meter. Make sure you choose the right meter that is going to last you for a longer period of time. Okay, and then store it properly. Store it properly. It's very important when store it properly. Okay, so now your A1C. Okay, I'm going to just briefly touch about A1C. I'm going to just briefly touch about A1C and we'll go to topic 2 because we have about 1 hour more to go. Your A1C is your hemoglobin. It's a hemoglobin. Okay, it's a test used to measure your average blood sugar levels over the period of 3 months. So, as a diabetic, apart from the daily checking of your sugar levels, doctors monitor your progress of your treatment every 3 months. Okay, every 3 months, they take an average reading of your sugar levels to know how your medications are working. Are you responding to treatment? Are you controlling your sugar levels, or is it getting worse? So your hemoglobin A1C test is used to measure your average blood sugar levels for the period of past 3 months. So every 3 months, your doctor will require you to go and do some blood work and then send you to do some urine tests, check your urine, make sure there's no sugar in your urine, check your kidney. And I've said to you, some doctors might not test your kidney and liver, but I know those in Africa, others will say it's going to be very expensive to request for kidney function test or liver. But I would advise all my fans here, pay that a little bit extra when you are going for your 3 month, that A1C test, check your kidney and liver at the same time. You don't do it every day, it's every 3 months. So you can start saving the money to say, okay, in the next 3 months, I'll be going for my A1C test and save that extra money to check your kidney and liver function. It's very important because your kidney and liver functions are the things that the diabetes attack and destroy quickly. If you don't protect it, these are the things that diabetes go to attack and destroy. And that's why we have too many people in dialysis. And you know that kidney or liver is not something you can go to the market and buy. It's who is going to donate you a kidney or who's going to donate you a liver. So save that money. And when you are doing your A1C test, request the doctor, please, can you check my liver and kidney? Because they don't usually indicate it. They only check your blood sugar levels and then your A1C test, and that is it. But make sure you request that extra test. Ask doctor, please, I want to check my kidney and liver. At least you are sure that your kidney, because we look at the functionality of your kidney, the percentage, there's a number we look at. If it's below 30, then there's a problem. It's above 30, then it's okay functioning properly. So at least you are sure that you have a functioning kidney and liver. Because you don't want to go to one of the checks, they say your kidney is not functioning properly because your sugar level is not destroying all the nerves. And remember that everything that you consume filters through the kidney. So spend that little money to check your kidney and liver. You might look healthy outside, but internally you are not looking healthy. Okay? So check your kidney when you're doing your A1 test, check your liver. Doctor is going to recommend for urine test. They're going to also check your urine to make sure the coloration, if there's any culture, and to make sure there's no sugar in it. Okay? And then doctor is also going to check your lipid. Your lipid is your cholesterol. Make sure you check your cholesterol. Ask your doctor, please, I need my cholesterol to be checked. Because sometimes doctors are not going to check it, except you request that I want cholesterol checked. So cholesterol is very important. Your high blood pressure is something you don't pay, because every time you visit a doctor, they check your blood pressure and then record it time and date, and they take your measurement also and your weight and they record it. But cholesterol is something that you need a blood work. So request for cholesterol check, request for a kidney test, function test, request for liver function test. At that 3 months, you are at least you know every 3 months I go for my blood check, my kidney and liver is functioning properly, so I don't have anything to worry about. You check your cholesterol to make sure your HDL is okay. You don't have LDL. These are very, very critical things that you need to check when you're doing your A1C test. Okay, and also there's something we call CBC test, complete blood CBC, complete blood count. If you guys check go to my page and check one of my videos, you see where I put my own test that I did. Okay, you see my lab result there. The lab result that I did is one of my videos there. You could see everything. My CBC blood count test, everything that is done. I shared my I shared my lab test on the system there. Request for the CBC blood count test. Okay, you see it's about 50 tests they check on that CBC blood count. At least that gives you overall health condition of you. Okay, so there they can, because if you're constantly checking your CBC test, one thing we do about CBC test is that if there are illness that is going to come in the next 2 years, if there are illness that you are going to have in the next 2 years, they can see it early in your CBC test and start managing it properly or start treating so that it doesn't come to you late. There are sicknesses that we can see through your CBC test, because that is a complete X-ray of your overall health. So doctors can see from those tests if there's an illness coming on the way in the next 2-3 years. They can see it there and advise you properly, and they start managing it now before sometimes, because the earlier you caught it in time and start treating it, the better. Then you show up one day, they say the thing is there. It's already too late. So that is why you have to do CBC tests. It's going to cost you money, complete blood count. But I'm just giving you guys these tips to know. All right. So these are things you have to do on your A1C test. Okay, because there's an average blood sugar level for about past 3 months. It can be useful tool for managing diabetics and can be used to make adjustment to your treatment plans and goals. So everything I said about in this A1C test, now it's all about A1C, your CBC blood count test, your cholesterol, your check your urine test, check your album test, also check your liver and kidney function. These are the things you're supposed to do. Okay, so I'm gonna just I'm going to just, so that we can go to topic 2. I want to go to topic 2. Okay, Maxwell, thank you. Chamberlain, I'm going to answer your question, just hold on. Okay. So now we're going to go to topic 2. Okay, because this A1C is if I want to discuss A1C, it's going to take us another 1 hour. So I want to go to topic 2. I want to cover all those 5 topics on this diabetic essential. So let's Chamberlain says, my mom has low blood sugar and it is affecting her sight. Seriously, how can she control it? Yes, I just said it yesterday. If you follow me yesterday, and I just even said it now, don't allow your blood to go low. If you go low, you're going to be seeing other symptoms. So what you're telling me, your mom's side is very good. Yes, because she has a low blood sugar. So she's going to be having a blood vision. Okay? If you're okay, don't allow your sugar level to go low. Hold on. I'm going to post something here. I'm going to post something here and then we'll answer your question, Chamberlain. Ah. Okay. So Chamberlain, I'm going to post something for you to share something with you guys here, but let me go. Listen, your mom is experiencing what we call, let me go. So Chamberlain, your mom is experiencing what we call hypoglycemia, which is low blood sugar. Hypo means low blood sugar, okay? And then hyperglycemia means high blood sugar. So hyper means high. Your mom is high blood sugar, and then hypoglycemia means low blood sugar. So what your mom is experiencing is a low blood sugar. She's having the symptoms of low blood sugar. Okay, she might be looking pale, shaking, headache, hunger, or nausea. That blood vision, she's not seeing properly because she's fatigued, and then anxiety follows in because the sugar is too low. Because when your sugar is too low, you are weak, you are sweating, you are shaking, you are looking pale, you are irritated because you can't recognize them. You know, everything is just confused because your sugar is too low. And remember, what did I say about energy? What did I say about glucose? Chamberlain, are you listening? What did I say about carbohydrate? What did I say about carbohydrate is equals to glucose? Now, despite that you are diabetic because of your lifestyle or it's hereditary, you consume too much glucose, and that glucose, when it goes into your system, it breaks them down and convert them into glucose and dump them into your bloodstream. Remember, I said, okay, a car needs a fuel to operate. If you are driving a car and the fuel finish, that car will stop. It's not going to start until you refill it for it to start and take it to the destination. The same thing applies to your body. Carbohydrate is the fuel that your body needs to be functional in everything that you are doing. Despite you are diabetic, you still need that carbohydrate. And that carbohydrate, when eaten, it converts it into glucose that supplies you the energy that gives you that strength to do things that you're supposed to do. Now, if your body lacks that energy, maybe your glucose is low or there's no carbohydrate, what happens? You look weak, shaky, sweating, confused, irritability, because you don't have energy anymore. So when that thing happens, it means you don't have any energy. There's no glucose in your body. You are weak. So what you have to do is inject insulin. You apply insulin, and that insulin is going to boost up the sugar level to the normal range. And once that sugar level arrives at the target range, your mom is going to feel better and gain her strength back. Now, if you don't have insulin and your mom experienced low blood sugar, that is why I said yesterday, if those that are following me yesterday, when we were doing on the fan forum, I said, if you are living home, if you have a mom that is diabetic, a father, a son, a daughter that is diabetic, make sure when they are leaving home, you have something like 2 bottles of Coke in that bag, or chewing gum, or biscuit, anything that contains sugar should be in that bag. So that when that person have a low blood sugar. You don't have insulin. If you have insulin there, you can inject her insulin to bring the sugar level up. But if you don't have insulin, like Chamberlain, your mom has a low blood sugar. She's weak. She can't see. All you have to do is to go and get a Coke. Give her a Coke to drink. Find something that contains sugar and give her to take. And then that sugar, her sugar is going to rise up to that target range. And give her about 15, 20 minutes after taking a bottle of Coke. You see, within 15, 20 minutes, your mom is going to be okay because the sugar range is at normal, and then she's going to gain her energy back to function properly. That is why I said you must know the basics, and that is what we are discussing today, Diabetic Essential, the art of mastering the basics of diabetics. So now you know what to do that your mom has a low blood sugar and she's having a symptom of low blood sugar. If you have a bottle of Coke there, give her a bottle of Coke. Give her 15, 20 minutes, your mom is going to be fine. Her sugar level is going to come up. You see her fine. The one I say give her a bottle of Coke does not mean you go to the market now and buy 24 bottles of Coke and give her to drink in 1 minute. That means you are killing your mom. All she needs is a small Coke, even a chewing gum, something that contains sugar for her to take. The sugar is going to rise up to the normal range and your mom is going to feel better. But do not allow your sugar level to go low for a longer period of time because it's going to send her to a different territory called coma. And when she goes into coma, you are sending her to her grave early. So when your mom experiences a low blood sugar, it must be treated immediately, instantly. Give her something that contains Coke to boost up her sugar level, and she's going to be okay. So I made myself clear, Chamberlain. I wish her good luck. Let's go to the next. Let's go back to the topic. Now, I'm going to go back. Let's discuss topic 2. Chamberlain, I hope I've answered your question. And I believe I've answered everybody's question. All right. We are going to go to topic 2. Now, we finished discussing blood sugar and A1C. So let's go back to topic 2. And can somebody tell me what topic 2 is on the screen there? What did I post? I don't want to make mistake. Can somebody tell me what is topic 2? Abubakar, can you tell me what is topic 2? Who is there? I need. I need somebody to tell me what is topic 2. I listed it there. I want to make sure everybody is following me. Put it on the comment section. Put it on the comment section. What is topic 2? We finished discussing topic 1. So we have to go to topic 2. Can somebody tell me what is topic 2? You're right. Carb counting. Good. All right. So we're going to discuss carb counting now. Now, Chamberlain, another issue about your mom's sight affecting her sight. Okay. Because you told me that she's having a low blood sugar. If it's a high blood sugar, then I will know. I will coordinate. Because if it's you're telling me your mom has a high blood sugar now and it has sight problem, then I might say your mom is having a retinopathy, the nerve damage is damaging her eyesight. But you said it's a low blood sugar, so that is different. So all you need to do is to give your mom something that contains sugar to boost the sugar level up to get herself normal. So let's go to carb counting. Carb counting. I'm going to discuss carb counting, and then Max Smith asked me a question: which best food to take and vegetables? We're going to discuss it now on the carb counting and low carb eating. So we're going to discuss topic 2, carb counting and low carb eating, because more or less they're the same thing, but I'm going to take them individually. So let's go to carb counting now. Yesterday I was discussing about how to start counting your carbs. Is very important. Okay. Yesterday I did. Yesterday I did. Okay. we'll talk about carb counting. Yesterday, I did touch about it on the forum side. We talk about carb counting on what you eat. And this morning, I touched a little bit about it on carb counting. As I said, you can take your medication for 15, 20 years. If you are not taking care of your eating habits, your diabetes is going to still be on the high side. And I agree with all of you. I know everybody find it difficult in managing diabetes in the area of carbs. I mean, dieting. Dieting is the most difficult things. Most everybody find it very difficult to manage. And I can understand the factors, the reasons they give, the location, the country. Okay, some countries, Africa, it's not like a Western world where we have all the kinds of food. In Africa, most countries they have their peculiar dish, and then they can't find most of those food that we can find here. They only have one type of food or two type of food, and even those that can afford those kinds of food, it's luxury. Nobody can afford. So how can you tell a farmer to go to the market and buy a salad? All those expensive salad, legumes, prepare it nicely. They don't have that money. Okay, so yes, so I listen to all those reasons why this dieting is very difficult. You have a farmer who goes to the farm, he needs energy to go to the farm and till. So what do you expect him to be eating? Like I was talking to one of my friends in Africa, and I was telling him, listen, man, the issue with you is about your diet. That's why your blood sugar is always high. And he told me, Doc, I was laughing. This is a laughing matter. I told him what to eat. You have to go and eat a lot of vegetables, salad, broccolis, all this garbage. And the doctor, he told me, Doctor, I'm a farmer. What you are telling me to go and eat grass? I'm not a cow to go and be eating grass. If I eat grass, how am I going to farm on the? It's not going to. I need my, I need my swallow so that I will have energy to go and farm. So I was laughing. I said, see it? Because he sees those salad as grass. Why should I be eating grass with the cow? Or you see a human being taking. I said, that is what you're supposed to be eating as a diabetic. That food you are eating because you want to go is what is causing your problem. You look, I said, you have to sacrifice on those food. Otherwise, your medication is not going to work. So dieting is the very difficult aspect in managing your diabetes. And learning how to count the carbs is another issue. And that counting carb is what drives a lot of people crazy. When I start discussing about carbs, it drives them crazy. He said, Doc, what are you telling me to do? I'm going to start counting carbs. I have to eat. I said, well, you are diabetic now, so now you have to count your carbs if you want to manage it properly. So why should you count carbs? Why you should count carbs while you are diabetic is that it gives you an average amount of food to consume, not to affect your sugar level. Remember, now you are controlling your sugar level manually because your pancreas is not functioning, it's not producing or functioning properly. Because there are two things about pancreas: it's either it's not producing or it's not functioning properly. I discussed it yesterday about the producing aspect and the functioning aspect. Okay, so now if you are not diabetic, it means your pancreas is doing it automatically for you. So you can eat anything you want to eat. Once your sugar level goes above high level, it's going to trigger your pancreas to release insulin into the system to mop up the excess sugar and then store them into your cells. But now that your beta cells have been destroyed, your pancreas is not producing enough insulin that your body needs, or your body cannot use it properly, correctly, to regulate your sugar level. So now you are doing it manually, and that is why you have to count your carbs. Now, counting your carbs, you have to know the numbers. Okay, and I've said it several times. Figuring out how many carbs to eat when you have diabetes is very confusing. Yes, that I agree with you. Now, dietary guidelines from around the globe traditionally recommend that you get around 45 to 65% of your daily calories from carbs. I'm talking about calories from carbs if you have diabetes. Okay? So now, counting your carbs will help you ensure that you stay within the range that best suit your diabetic situation. That is why you have to count your carbs. Okay? And then yesterday we talked about different types of carbs. Okay? Now, and I was saying yesterday about carbs is any food you eat in that plate of food that does not contain carbohydrate is not a complete diet. Carbs is essential part of your diet. There are 3 things that must be in that plate. We call it macronutrients. There are 3 out of the 6 nutrients. I think we have 5 or 6 nutrients. Out of the 6 or 5, we have 3 macronutrients that must be in that plate. Carbohydrate is one of it, which is essential. Protein and then fat are the 3 macronutrients out of those 5, 6 nutrients we have. Any food you eat that does not contain carbohydrate is not a balanced diet. It must contain carbohydrate. But the question now is, as a diabetic, how many carbs should I have in that plate to be a balanced diet and not to affect my sugar level? Remember, if you're diabetic, anything you eat, you are conscious of your blood sugar level, not to spike up. And I've told you guys several times, for every meal you eat must have 15 grams of carbohydrate in that plate. That 15 grams of carbohydrate is enough to supply you that energy you need to function properly. And it's not going to affect your sugar level. And that is why at the same time, we've said you go to practice portion control. Now you're a diabetic, you have to practice portion control. And in a day, and that is why I just said you need about 45 to 65% of the calories obtained from carbs. So in a day, either a man or a woman, you need about 60 to 65 carbs per day, 15 grams per meal. Now, somebody's going to ask me, how do I measure? How do I know this food is 15 grams per meal? And I'm going to give you guys several tips. Now, I'm going to how to know how to count your carbs, because you don't have a way to weigh the food to do 15 grams. Now, first of all, you have to know the type of food to eat. Once you understand the type of food to eat, then you'll be able to know, now measure the carbs in them. And I give you guys an example. For instance, I say stay away from white rice and go for brown rice because it's rich in fiber, low in carb, and a lot of nutrients in them that is going to help to manage your blood sugar level. Because carbs, they belong to a complex carbohydrate. And what does it do? Because instead of spiking up your sugar level, it helps to mop up the excess sugar that's in your bloodstream. That brown rice, it helps to mop up, absorb all the sugar in your bloodstream and store them in your cells and the muscle tissues. Now, because I said instead of white rice, go for brown rice. Now, if you identify that I need a brown rice as a diabetic, how do I measure 15 grams of carbs in them? And I'm going to give you guys a simple tips now, how to measure it. In every home, we have those big spoons. You know those big spoons our mom used to prepare soup? Those big spoons is about, you guys know those big spoons, not the smaller spoon you eat. You see at the tip of that spoon, it's like deep inside. That big spoon. I don't have one here. The one I have here is not, it's the flat one. I'm gonna just a minute. Let me show you guys something. All right, I'm back. So let's give you guys a tip. This is a spoon. You see this is a spoon now. Can you guys see it? It's a spoon. In our kitchen we have the bigger spoon, the big one, not the small one. And in that big one we have here where you used to get that food. There is a reason why in that big spoon they make it a little bit deep. Instead of making it flat, they make it deep. So that when you try to take rice, you take some. That thing, there's a reason why it is. So your 15 grams is that 1 scoop of spoon. So when you take that brown rice, that one covers your 15 grams. That's a reason for it. Okay? So because I say you should take brown rice does not mean you go and then take 5 big spoons and put in your plate and eat. No, remember that rice contains a little bit of carbohydrate, but it is about 60-70% more fiber. So when you take that brown rice once in that big spoon, that counts at 15 grams. That is enough. And that is why when you go to some restaurants, all these Western restaurants, you see them when they want them to bring some rice, you see them bring a small, in one corner of the plate, there's a small rice, vegetables and that. because they measure it with that spoon. So when you take that big spoon and take 1 scoop, that measures your 15 grams. You don't need to take 2. That measures your 15 grams. So that is the tip. I'm giving you guys a tip now, how to take your 15 grams of rice out of that brown rice and your oatmeal. If you're going to take a swallow, you're preparing a swallow, you press a swallow and use that spoon to take a big out of that swallow, but then that covers your 15 grams of carbohydrate. Okay? Now you understand that you need about 15 grams per meal. I need about 65 grams of carbs per day. We have different types of carbs. And I've said it yesterday, we have the simple carb, we have the complex carb. In fact, we have 3. Okay, out of those 3 carbs. Okay, the simple and complex carb comes from one particular type of carbohydrate. But we have 3 main type of carbohydrate. But the simple and the complex carb comes out of one of those carbohydrates. So the first carbohydrate is called sugar. Okay, just hold on. I'm gonna So what are the different type of carbs? There are 3 main type of carbs. We have the sugar, we have the starch, and we have the fiber. Okay, these are the 3 main type of carbs. But the simple and complex carb comes out of one of these carbs, and we're going to discuss it. All right. Sugar belongs to a type of carb. Starches belong to a type of carb, and fiber belong to a type of carb. All right. So let's see. All right, let me remove this now, because I want us to rush this. Okay, let's deal with number 1, sugar, as one form of carb. Okay, sugar is one form of carb. Sugar belongs to a category known as simple carbohydrate. Okay, so I want you guys to listen properly. Sugar belongs to a class of carbohydrate called simple carbohydrate. And I told you guys what simple carbohydrate is because your body can break them down easily as soon as you're eating them and then convert it into glucose and dump them into your bloodstream. So simple carbs have 1 molecule of sugar, monosaccharide. Okay, simple carbs have 1 sugar molecule called monosaccharide. If it is 2 sugar, it's called disaccharide. Okay, so sugar belongs to a class of simple carbohydrate because your body can break them easily and convert it into glucose and the spike of your sugar level when it dumps them into your bloodstream. And it has 1 sugar molecule. Okay, now sugar is found naturally in foods and beverages like whole fruits, okay, juice, milk products, and honey. It's also added to processed foods such as candy. You can find sugar in most of the food that we eat naturally, or they could be added. Okay, that is why they are simple carbohydrate. Okay, I'm going to do something here now. I want you guys to read this. Sugar belongs to a category known as simple carbohydrate. simple carbs have one sugar molecule. It's called monosaccharides, or two sugar molecule called saccharides. Sugar is found naturally in foods and beverages like whole fruits, juice, milk product, and honey. It's also added to a processed food such as candy, orange juice, grapefruit juice. As long as they are processed, there is sugar added in there. Okay, that is one form of carbohydrate. So sugar is one form of simple carbohydrate. All right. So let's go to starches. Let's go to starches. Okay, this is where it becomes interesting. Let's go to starches. Remember, I said we have sugar, we have starches, and we have fiber that form three types of carbohydrate. Okay. Starches. Okay. Or starch and fiber. Okay. Starch or starch are both complex carbohydrate. Okay. Starch and fiber are both complex carbohydrate. Complex carb have at least 3 sugar molecules. The body takes more time to digest or break them down. Starches than sugar, okay, and it can digest fiber at all. It cannot digest fiber at all. So I'm going to repeat it. Starches and fiber are both complex carbohydrate. And I've told you guys what is complex. Complex carb have at least 3 sugar molecules. The body takes more time to digest or breaks down starches than sugar. And it cannot digest fiber at all. That is why I've said it consistently, go for fiber food because they are complex. Okay? I'm going to post it here for you guys to read, and maybe you guys can understand what I'm talking about. For those, my friends, that cannot so I want you guys to read it before I go to. I want you guys to concentrate on fiber. Why? If you're a diabetic, they say go for fiber instead of carbs. Okay? Starch and fiber are both complex carbohydrates. Complex carbs have at least 3 sugar molecules. The body takes more time to digest or break down starches than sugar. And it cannot digest fiber at all. That is why when you eat food that are rich in fiber, it does not affect your sugar level because your body cannot break down fiber at all. So even though you are eating them, you are sure that your sugar level is going to still remain same. Starches are found in food like potato, corn, legumes, and whole grain bread and pasta. Okay? So instead of going for simple carbohydrate, go for complex carb. So instead of going for starches, you go for fiber. Even those starches, your body cannot break them down easily. But the one that your body cannot break down at all, even though you are consuming them, is fiber. And that is why doctors will tell you concentrate more on fiber food than simple carbs. Even though starches and fiber, your body cannot break them that easily. Starches, your body cannot break that easily. There's two different things you have to understand. You can never see a doctor that says go and consume starch, less carb and more starch. No, doctors are going to tell you less carbohydrate, more of fiber food, because your body cannot even break down fiber. And you don't want something that you're going to eat and then it's going to spark up your sugar level. So that's why you see you have to concentrate your food on more of fiber foods than carbohydrate. So corn belongs to a group of starch, potato belongs to a group of starch. You're going to stay away from it. Even though your body cannot break down easily, but what your body cannot break down easily at all, not even attempt to break down, is fiber. So that's why you have to go to legumes, whole grain breads, and Pasta belong to a class of starches, so stay away from pastas. But legumes, vegetable, and whole grains or oats are fiber. So concentrate on more fiber food that your body cannot even break down because they are complex carbs. Okay. Now, let's go to fiber. We'll talk about fiber. Okay. Fiber food. We'll talk about fiber. Um, so I've said it. Concentrate on more fiber food. Okay. Concentrate on more fiber food. So go for more fiber. Fiber is found in food like fruit, vegetables, legumes, nuts, and whole grain. Unlike sugar and starches, natural occurring fiber doesn't raise your blood sugar levels and may even slow it right. So you see the reason why you have to stick to fiber. Okay. Are you guys listening to me? Are you guys listening? All right. I need a confirmation. Are you guys listening? I need a confirmation. Are you guys listening? All right. So let's go to uh, we're still on counting carbs. So I'm going to give you guys the tip on counting carbs. Okay, tips on counting carbs. I've already discussed to you how to determine your daily carb at the maximum. That's number one. Number two, learn how to read the food labels. I've said it yesterday when I was showing guys. Um, okay, learn one, determine your. So now you know your daily and your minimum and daily max of carbs. That's tip number one. Tip number two, learn how to read a food label. Okay, if you're diabetes, anything you are buying from the store, make sure you read a food label because forget about what they display on the shelf there. It might be different from the content labeling. So you have to read the food labels. Okay, you have to read here is very important to know the carbohydrate content percentage and know the fiber content, know the sugar content. Even though it says 0% sugar, does not mean you should be happy to buy it. Also look at the carbohydrate there because the carbohydrate is something as the sugar there. Because at the end of the day, your body is going to break down those carbohydrates and then convert it into glucose and then still affect your sugar levels. So learn how to read the food label to know the content and then per serving. Also pay attention on per serving. How many should I take per each meal is very important. Look at the calories because at the end of the day, you shouldn't be adding more calories. You should be burning the calories. So these are the information that you need when reading the labels. Okay. When reading the labels. And then the final one is you can download an app to keep track of your daily intake of carbohydrate. There are a lot of apps that you can download that's going to keep track or how to calculate carbs or what type of carb to contain at what time. So those apps can help you to give you an insight on how to count your carbs and how to manage your carb consumptions. All right. So that is counting carbs. All right. Now let's go to number three. Number three is low carb eating. That is where I'm going to answer Max Mail. Max, are you there? Max, can you confirm? Are you still there? Max Mail. Because I'm about to answer your question now. Can you confirm? Are you still there? We're going to discuss about low carb eating. That is the topic number three. Low carb eating using diet to help stabilize your sugar levels. I need Max Me to confirm if he is still there with me because I'm gonna about answering his questions on this topic number three. Low carb eating using diet to help to stabilize your blood sugar. Okay, everything you want to know about low carbs is what we're going to discuss here now. Low carb eating can help to keep your blood sugar levels from rising too much and benefit your health in many other ways too. That's the importance of low carbs. All right. Um, Max Smith, are you there? Believe you are not there. Gone. All right. Why is it so important for diabetics to eat low carb diet? As I said in the counting carb section, low carb is very important and the more fiber because at the end of the day, why they say low carb, one, two things. Your body needs carbohydrate to function properly. And why they say you should consume low carb is low carb consumption might not affect your sugar level. The higher the number of carb you consume affects the balance of the sugar level. It's going to shoot it up. So that is why you have to, they say, eat food that are low in carbs and more in fiber. Okay? Because they help to keep your blood sugar levels on even levels. Maintaining moderate sugar levels can greatly reduce the risk of diabetic complications. As long as you are maintaining normal sugar levels at all times by consuming low carb diet, you are evading a complication that might arise from high sugar levels. Okay, that is why you have to eat food that are low in carbs and more of fiber. Remember what I just said in carb counting? Rather find food that are fiber because your body cannot break down fiber and it does not affect your sugar levels. All right. So now, people with diabetes experience long-term improvement in blood sugar levels while eating low-carb diets. All right. That's because people with diabetes are deficient in insulin or insulin resistance to its effects. So when they eat low carbs, their blood sugar can rise potentially dangerous levels unless they take medications. Okay. So when you consume more of food that are high in carbs, it might rise your sugar level to be in a dangerous level. Then you have to take medication to reduce it. And that is why you've been advised to eat low carb diets that will help to minimize the harmful effect of high diabetes. All right. So that's the reason why you have to consume. Now, is low carb better than low calorie? Okay. With type 2 diabetes, the immediate goal is to keep your blood sugar level within a moderate range. That's your immediate goal. Once you're diabetic, you're battling to make sure your sugar level is within the range target. So it carb the carb influence, okay, your body influence your blood sugar levels to either go high or to stay stabilized. Now, eating that's why same thing I've been saying, portion control. You have to eat in smaller quantity. All right. You have to eat in a very small quantity. It's advised. Apart from choosing diet food that are low in carbs, also choose a smaller portion to consume at that particular time. If you have to eat a second time, it has to be after 4 hours. So eat a portion of sugar or refined carbs, even if it doesn't take you past your daily calorie limit or your blood sugar to spike. Now, in terms of calorie, okay, in terms of calorie, remember the more calories you consume, the more weight you add. So you rather reduce your calorie intake in order to reduce your obese. If you're obese, then you have to burn down your fat, burn down, reduce your calorie to come down to the normal size that fits your diabetic situation. So instead of adding more calories, that's going to add more weight. It's better to choose food that are low in diet and at the same time low in calories. And that is why I said you have to know how to read the labels. When you're reading the labels, you're checking three things. You're checking the carbohydrate percentage, you are checking the sugar in it, and then you are checking the calorie. And then per serving is very important to know how many to consume at each given time. So also, since you are battling, you have to reduce your weight. Calorie is very important. Your calorie intake counts. So that is why choosing food that are low in carbs is also the same thing as choosing food that are low in calories. So look for those two things when choosing your diet, your food. Make sure they are low in carb, low in calories, and more in fiber. Um, Do we have any question? Do we have any question? Let me see what this guy asked me a question before. Okay, he asked me, Max Smith asked me if I have diabetes, which best food to take and vegetables. The best food for you to take if you have diabetes is to go on oats, whole grain meals. You have to choose food that are whole grain meals, oat meals, okay, bran meals. Okay, those are better. So instead of eating those pounded yam, semolina, cassava meal, gari, stay away from it because they are high in starch, high in carbs. So you have to go for whole grain meals. Go for grains. Africa is blessed with grains. Go for whole grain meals, okay, or wheat. These are good for diabetes because they are rich in fiber. And then when eating whole grain of wheat, make sure they are in a smaller portion. You have to eat every 4 hours. Okay, that is I'm responding to Max Smith's question. So go for whole grain meals or whole wheat or bran meals, BRAN, bran meals. Okay. Now, in terms of vegetables, there are a lot of variety of vegetables you can take and legumes. Okay, there are a lot of vegetables. Vegetables, you don't need to worry. As long as they belong to the class of vegetables, you are fine because vegetables are going to provide you a lot of nutrient, proteins, and then that fiber that you need. So, as long as they belong to a class of vegetables, you don't have anything to worry. Fruits also help to provide you those fiber that you need and the nutrient that you need. Where you have to concentrate your most effort in order not to abuse it is the carb intake, the type of carb, the type of food you eat. In terms of vegetables, you don't need to worry. Vegetables can be identified easily. Once they belong to a class of vegetables, because you know it's a source of proteins and vitamins and then the fiber that you need. So there are all kinds of vegetables that you can eat. Africa is blessed with vegetables, blessed with grains. In terms of vegetables and legumes, you don't need to worry about it. There are a lot of variety of legumes that you can take because uh, those are going to provide you those um, hold on. Okay. So when we are talking about vegetable food, we're talking about leafy greens. Okay. When we're talking about vegetables, we're talking about okay. So Denise, I'm going to answer your question. Just hold on. So vegetables are available in many varieties and can be classified into biological groups or families, including leafy greens. When we're talking about leafy greens, we're talking about lettuce, spinach, and silver beets, or cruciferous. Okay, cabbage, cauliflower, Brussels sprout, and broccoli. Okay, now if we are talking about leafy greens, we're talking about lettuce, spinach, and silver beet. Silver beet belongs to a class of leafy greens. They are vegetables. Then, if we are talking about cruciferous, under cruciferous we have cabbage, cauliflower, Brussels sprout, and broccoli. Those are under cruciferous. Okay. If we are talking under marrow, we talk of pumpkin, cucumber, and zucchini. Those are under marrow. Okay. If we are talking about root vegetables are potato, sweet potato. Those are root vegetables. So marrow is a type of vegetable. Marrow, we're talking about pumpkin, cucumber, and zucchini. Then cruciferous is another type of vegetables. Okay. Have cabbage, cauliflower, Brussels sprout, and broccoli. Then if you're talking about leafy green vegetables, we're talking about lettuce, spinach, and silver beet. So these are the type of vegetables. So leafy green is a class of vegetables. Okay, we have lettuce, spinach, and silver beet. Cruciferous is another type of vegetable. Under cruciferous, we have cabbage, cauliflower, Brussels sprout, and broccoli. Then marrow is another type of vegetable. Under marrow vegetable, we have pumpkin, cucumber, and zucchini. Then root is another type of vegetable. Under root, we have potato and sweet potato. So these are the type of vegetables that you can add to your dieting. All right. I'm going to answer. Uh, Now, when we talk about legumes, okay, legumes, if you're talking about legumes, we are talking about lentils, okay, peas fall under the class of legumes, broad beans, chickpeas, beans, okay, peanut, all those are legumes, okay, all those are legumes. So you can add vegetables and legumes into your diet. So under legumes, we have lentils, we have peas, we have broad beans, we have chickpeas, we have soybeans, we have beans, and we have peanuts. Those fall under the class of legumes. Okay. Now, Dennis asked a question. So I think Max Miller answered your question. Type of vegetables. Uh, let me see. Dennis asked a question. What is the best time to eat before bedtime? All right. Now, you have to eat your last dinner before 7 p.m. Okay? Your dinner should be before 7. Anything after 7, then you have to go for a light meal. What is the best time to eat before bedtime is before 7. Before 7, take your major dinner. And any food after 7 is supposed to be light meal, like snacks, like vegetables, salad, fruits. You cannot eat any heavy food after 7 p.m. Anything after 7 p.m. is like snacks. Okay, vegetables, salad, okay, uh, fruits. You can eat them after 7 p.m. You must make sure you eat your food before 7 p.m. And again, if you are going for a test in the morning, a blood test in the morning, the following morning, make sure you've eaten, make sure the last time you ate food before your test in the morning, there's 8 hours difference. So, for instance, if you are going to the hospital to do a blood work, you're doing your blood test in the morning, make sure the last time you ate before you go to bed is 8 hours till the time you're going to go to test in the morning. You must make sure you eat. You must have 8 hours gap before your test in the morning. So because that's why sometimes when you go and do your test in the morning, your sugar level is high. Then maybe you ate around 10 p.m. or 9 p.m. So if you go to your test in the morning, your sugar is going to be high because you didn't have enough 8 hours gap. You must be fasting 8 hours prior to your test in the morning so that you have a good normal sugar reading. So if you know you have a test in the morning, you must be fasting for 8 hours from the last time you ate at night till in the morning before your test in the morning. Okay, so there must be 8 hours gap. So that, and then if you have that 8 hours gap, you see that by the time you go and do your test in the morning, you see that your sugar level is not going to go that high. It's going to be stabilized. So your last food is supposed to be 7 hours, 7 p.m. Make sure you ate your last meal 7 p.m. Any food after 7 p.m. is going to be snacks and vegetables or fruits. Uh, Somebody's asking me. Okay, I think we've discussed the first topic. We discussed the carb counting. I'm discussing the low carb eating. That is what we are discussing now. So we have 2 more to go. We have alcohol and exercise. And I'm almost past my 2 hours. So Abubakar is asking me, what are the grains that are suitable for diabetes? If we have whole grain or whole wheat. Okay, so you have a whole grain or whole wheat flour, okay, cracked wheat, oatmeal, brown rice. Okay, so um, I'm gonna type it here for you guys too. I'm gonna type it here for you guys. So Abubakar, some whole grains examples are whole wheat, flour, bulgur, that is cracked wheat, oatmeal, and brown rice. Those are some of the grains. Now, do not go for refined grains. Stay away from refined grains because refined grains have been milled and processed. The nutrient in those grains has been removed. So if you're eating, that's why if you go to the market to go and buy some grains, you see some grains are more cheaper than the other. The one that is more expensive is the real grain that's going to provide you the fiber, the nutrient that you need. Then you are looking at the same grain, you see that there's a price difference. And you say, oh no, let me go for the cheaper one. No, those are refined grains. Refined grains is it's not going to give you anything. It's as bad as anything. It's like you're eating carbohydrate because they have been refined, milled, and processed, and all the important ingredients there have been removed. Okay, so go stay away from refined grains. Stay away from refined grains. Go for the whole. That's why they call it whole grain. It must be a whole grain or whole wheat. Don't go for refined wheat or refined grains. Okay, so stay away from refined grains. Okay. So, Abubakar, I hope I've answered your question. Desmond Filmi says, I want to know the difference between normal metformin and metformin prolonged release tablets, which taken twice a day. It's very from from um, from the uh, from the from the name. Okay. Where is that question again? Um, what is the difference between normal metformin and metformin prolonged release? Okay. Metformin, you know the use of metformin. We all know the use of metformin, and one is metformin prolonged release. It's very easy to understand the difference between they're all metformin. One is metformin, the normal metformin, and the other is prolonged release. Okay. Your diabetics, your diabetic situation, that was the same. Doctors communicate. What communicate to doctors is the numbers in front of them. Like, for instance, if you come to me now as a human being, I'm looking at you. You are going to tell me the symptoms, telling me everything. I'm looking at you. Okay. You are telling me the symptoms. I can feel. I can figure it's going to give me an idea what you are going through. But what is going to communicate to me, the language I understand as a doctor is the numbers in the paper in front of me. When I send it for a blood work and then the result come back with the numbers in front of me, it is communicating to me in the way that you as a patient cannot understand. So I'm looking at your record. It's communicating to me that there is something that is wrong that I need to change. So for instance, I put your metformin and I say, I'm going to watch you on metformin for 3 months. And then you come back, I send you for another test. And the test come back to me and I'm looking at the number. You're on metformin for 3 months, and then you came again and I send you another test and I'm seeing a different number. So I will say to myself, okay, your metformin, the numbers are not going the way I want it. So now I'm going to put you on metformin prolonged release. So it's like I'm increasing your dosage. I'm now increasing the fight to see that I can force down the sugar to come down to go the way that I want it. So that's why they're going to increase the dosage of metformin prolonged release, because you're on a regular metformin, it is not working. So it's like I'm going to give you another metformin that is more tougher than the one that we are using to see if I'm going to see a good result the next time I send it for your blood work. Okay, so that is the difference. That is the difference between okay. So that is the difference of metformin prolonged release. So if you're on metformin and then the absorption is not working properly, that the sugar level is still piling up, it's not doing it well, then I'm going to put you on the extended version. That extended version release means that it's going to slowly absorb into your bloodstreams compared to the regular metformin. So now remember how your pancreas work. The normal pancreas work when you eat food that contains a lot of carbohydrate and your body convert it into glucose and dump them into your bloodstream. As soon as your sugar level rises up above the normal level, the normal pancreas that is producing and functioning properly is going to release insulin into your bloodstream to absorb all the excess sugar into absorb the excess sugar in the bloodstream and then store them in the cells and tissues of your muscle. So now, when you are on metformin, it's supposed to act that way to control the sugar level in your bloodstreams so that your sugar level is not going to go high, and brings them down and absorbs them into your bloodstreams. Okay. Now, if that metformin is not working properly, because the doctor is looking at a different number in front of him, he's going to give you the extended version, which is the prolonged release. And what that does, it slowly absorbs into the bloodstreams. And once those drugs are absorbed into the bloodstreams, what it does is not absorbing the excess sugar that is in your bloodstreams and then store them into the cells and tissues of the muscles, compared to the normal metformin. So that is why doctors recommend the extended version of the metformin instead of the normal one. So you're going to see metformin ER or metformin IR. Okay. And metformin ER is the extended version. The metformin IR is the standard one. So if you're on the standard one, due to the number that is in front of the doctor, is going to determine whether to give you the extended version that is going to be absorbed slowly into the bloodstream to help to control your sugar level. Do I made myself clear, Dennis? All right. So apart from the controlling of the sugar level, there are other use of the extended version of metformin. There are other use for it. So probably your sugar level might be okay, but there are other reasons why doctor also give you the extended version. One, okay, the main reason is to control your sugar level if it is too high. If the regular one is not working properly, they give you the extended version, the ER, is to control your high sugar level. But there are other reasons. It might be used to also prevent kidney damage. Okay, blindness because of nerve damage. If you're not remember constantly when your sugar level is high, it's damaging your nerves. So if doctor put you on extended version, it might be because he's looking at other things, your kidney, your liver. Okay, so maybe he give you the extended version now to also help to prevent kidney damage. While it is controlling your sugar level, your doctor might also want to protect your kidney, also protect the nerves connecting your retina, not to have a blindness. So there are other reasons why doctor will remove you from the standard form and give you the extended version, because the extended prolonged release also helps to protect your kidneys, prevent your blindness, nerve problem, loss of limb, and sexual functions. Because remember, too much concentration of high blood sugar can also make you to lose sexual pleasure. In terms of women, they will lose the libido. In terms of men, there will be no erection. So if doctor remove you from the standard version and give you the prolonged version, maybe there's something he's seen on your reading that he wants to protect, protect you from kidney damage, blindness, nerve problems, loss of limb, and sexual function problems. So there are other factors why doctor will remove you from the IR1 and put you on the ER1. Okay, so if doctor put you on the ER1, then there is something he's seen on your numbers that is okay. I'm going to remove you from the IR1 and put you on the ER1 in order to protect all the nerves and organs of the body. Like yesterday, I said it yesterday when I was doing the fan forum, that if you're a diabetic, an experienced doctor will try to protect your kidney. If you watch my video for yesterday, I did mention it. A doctor that specializes in diabetes would like to protect your kidney and liver. So they will give you another drug to protect those two organs. So that because that is the easy thing that diabetes can damage. If you're a diabetic, he's looking for your kidney and liver to damage it. So an experienced doctor would like to protect those two organs by removing you from the standard metformin and put you on the extended release one. Because that extended release ones will also control your sugar level and at the same time protect your kidney, protect your nerves against your eyesight not to go blindness, and also nerve damages, loss of limb, and also sexual problems. Because if you have problem with diabetics, men also have problem with erectile dysfunction if the sugar level damage the nerves. In terms of women, they may not have pleasure, engage in sexual activities because the libido is not going to be there. So doctors will help. If doctors see certain things in your record, they will try to protect those things against diabetes, not to damage them. How can a man live without sex? It's not possible. Okay, in terms when they don't have erection, nothing kills a man if he's not going to have an erection. Okay, the same thing a woman. Every woman needs a man in the home. So there's also the aspect of sexual pleasure. So doctors will see all those things, try to protect them early, not to have consequences. All right. So I believe I've answered those questions, Denise and Abubakar. So now we've answered all the. I've done the topic number 1, topic number 2, topic number 3. So we are going to do topic number 4, which is the alcohol. We're going to go into alcohol, and then the last one is exercise. Yesterday, I did discuss on the fan forum. We talk about alcohol on the fan forum. Okay, we talked about alcohol yesterday on the fan forum. All right, drink it if your medication. That's what generally, apart from diabetics, if your medication, you've been advised not to consume alcohol because of the interference of the acid in alcohol with the medication you are taking. It's not like the medication is not going to work, but when there's an interference with alcohol on the medication, it might not work properly. Okay. Okay, Desmond, yeah, the number is good. Yeah, Desmond, the number looks good. The number looks good. All right. Alcohol may affect your blood sugar levels, interact with diabetes medications, and contribute to complications. But drinking a moderate amount of certain type of alcohol, such as red wine, may be safer. So either you are drinking socially or you are a heavy drinker, okay, you might be advised to stay away from alcohol. All right. You might be advised to stay away from alcohol because of the interference of the acid in it. Okay. Do you have any question more? I'm on the fourth one now, alcohol. We're talking about alcohol. Um, we are talking about alcohol. So drinking alcohol may affect your sugar levels, interact with your diabetes and medication, and contribute to complications. But drinking moderate amount of certain type of alcohol, such as red wine, may be safer. Okay, so you got to stay away from whiskey. Whiskey contains a lot of acid. Stay away from whiskey. If you are on diabetics medication, even I preach against red wine. Anything that contains red wine still contains a small amount of alcohol. But if you are diabetics, I preach against taking alcohol because of the interference in your medications. So some will say take red wine. Yes, red wine might be safer, but it is not completely alcohol free. So anything that's going to interact or interfere with your medication when you're diabetes, I preach against it. So I will preach against staying away from uh, staying away, So if you're diabetes, drinking alcohol may be safe if you, as long as you choose the right type of drink and consider alcohol effect on your blood sugar levels. There are some alcohol that contain sugar in it because of the lactose in it. There's some alcohol that contains sugar in it. Okay, if you can find an alcohol that is free of alcohol, um, Evaristus, if the alcohol is free, look at the carbohydrate that is in it. If the alcohol, you see, if you say alcohol is free, also look at the label, read the label to see if it contains carbohydrate. If it contains carbohydrate, then stay away from it because the carbohydrate is the same thing as the sugar that you are running away from. So if it says alcohol free, look at the carbohydrate that is in it. All right. So you got to read the label to understand what you are taking. Okay. So you got to be very careful because the way alcohol will interfere with your medication is the insulin. Because the medication you are taking is the insulin that is in it to control your sugar level. So once the alcohol interferes the way your medication works, then you're going to have problem controlling your sugar level. So I always advise to stay away from alcohol. Okay. So do we have any question? because alcohol, I don't have anything to say, on alcohol. It's very easy. I always approach alcohol differently. If you are taking medication, it interferes with your medication. So you have to stay away from alcohol. Whether if it's alcohol free, if it says alcohol free, you read the label to see if it contains carbohydrate. If it contains carbohydrate, then why taking it? Because it says alcohol free, but it contains 43% of carbohydrate. You drink it, it's going to convert that carbohydrate into sugar and spike up your sugar level. So that is why it is important to read the label. If it says 0% sugar or sugar free, read the label to see if it contains carbohydrate. Except it says 0% carbohydrate, 0 calorie, 0. Okay. I don't want to use, because I'm going to do I'm doing a video. I'm going to be releasing some videos. I'm going to be releasing some videos on what I'm working on now. Okay. So I don't want to use it on this particular presentation. Maybe when I post the video, you see the type of drinks you should go for. Except it says 0% carbohydrate, 0% calorie, 0% sugar, 0% protein, 0. Yes. But if it says 0% alcohol, 0% sugar, and 30% carbohydrate, then it's of no sense. Stay away from it. That is why you have to read the label. So do not be fooled when you go on the shelf. It says 0 alcohol, and then you grab it without reading the label to see that it contains carbohydrate that is 40% carbohydrate. It's of no use. So read the label to make sure that it does not contain carbohydrate and 0% alcohol and 0% sugar. Then you can drink it. So that is why I'm not if you are diabetes, I will not encourage you to take alcohol. Okay, because of the interference in your medications and management of diabetes. Then let's go to exercise. Exercise is very important. 2 hours and 30 minutes already. So let's go to exercise, and because I have another program, I have to go and rest, eat, because I have another program starting we're supposed to have 3 programs today, but it's like I'm not going to be able to do the afternoon program. I'm going to wait for the diabetes forum starting by 5 p.m. I'm going to do another program starting by 5 p.m. So I have to go and rest. And prepare for. So just make sure you set your time. 5 p.m. we are going to do the diabetes forum, where I'm going to answer all the questions that are coming in. Okay. So at 5 p.m. today, we're going to have diabetes forum. So also get ready for that. Mohammed Ngeye is watching from Spirit Town, Sierra Leone. You are welcome. Okay, you are welcome. Now, if this is your first time to come across my page, you've not subscribed, you've not followed my page, please kindly do so. Go to my page and follow me, so that when I'm online video, you'll be notified, and set your notification on so that automatically, anytime I post a video, they will send it automatically to your feed. Okay, at any time I'm doing something on my page, you'll be notified automatically. So if this is your first time, go and subscribe to my page. Okay, go and subscribe to my page, and then like, comment, share, and subscribe to my page if this is your first time to come to my page. All right, now I have 2 pages on Facebook. Okay, the one you are watching this program is called Managing Diabetics TV. Okay, the one you are watching this program is called, look at the top right hand corner on this screen. You see the logo there says Managing Diabetics TV. Okay, my second page on Facebook is called Living with Diabetes. You see, I changed the logo now. It says Living with Diabetics. Okay, it says, if you go to Facebook and search Living with Diabetics, you're going to see this Living with Diabetics. It's my second page. You can follow me on that page also. And then also on this page, you see, I change it now. It says managing diabetics. All right. And then on YouTube, you're going to find me on YouTube. It says managing diabetics TV. So you can follow me on YouTube also, and also follow me on Instagram. So if this is your first time, kindly go and do so. All right. Now, so let's talk about exercise so that we can call it a day and meet again by 5 p.m. my time. Please, before I do the last topic, okay, I have a lot of people in different countries, different regions with different time zones. We have different time zones. So my 5 p.m. will be different from your time there. So the only way you can know when I say my next program is starting by 5 p.m. my own time, 5 p.m. United New York time. Okay, 5 p.m. New York time, Eastern time. You go to Google, type 5 p.m. New York time. It's going to tell you what is going to be your time in your country, your local time in your country, so you know what time to join the program. So now you know it's 5 p.m. New York time, Eastern time. You go to Google, type it 5 p.m. New York. What will it be? It's going to tell you exactly the time in your country, so you know the time to join. If I say 10 a.m. New York time, like today, you go to Google, search it, it's going to tell you the exact time in your country to join. So every weekend, I start my program on Saturday, 10 in the morning, and I do another program 3 in the afternoon, and I do the last program 5 p.m. But today we are going to do 2 because the one in the afternoon, I won't be able to squeeze it in. So I'm going to wait for the one 5 p.m. So always go and search to know the equivalent time to join the program. So let's talk about the exercises. Exercise is another thing that is very important in managing your diabetics. Okay, exercise is very important. As I said, you can manage your diabetics without even being on medication. You can manage your diabetics without even being on medication. There are people that are doing exercise and they are eating a balanced diet and they were able to control their sugar level without ever being on medication. Exercise is very important. Dieting is very important. These are the things that you have to do to manage your diabetes. And exercise plays an important role because once you are doing exercise, it's going to help you to reduce your weight, burn those fat, and reduce your calories. So anything that can make you physical active, make you to sweat is good. I cannot give you any specific exercise. There are exercises you can even do in your room without even stepping outside. For instance, if you are living in one upstairs, that is 1-story building, your staircase alone is that exercise that you need. You can climb their staircase from the ground, from your living room to your top bedroom 10 times. You start from the ground floor, you walk upstairs and walk back is 1. So when you start from your ground living room and you go up and come back is 1. You go back again. So by the time you do it 5, 10 times, you see there will be changes. You are sweating. Those are physical activities because now your heart rate has changed. You are breathing hard. You are sweating. So if you can do it 10 times today, tomorrow you do it 20 times. So that staircase already is an exercise. If you don't have, if you are not living in 1-story building, okay, you can, or maybe you don't want to use the staircase. You have a big compound. You and your son can go in the front compound and be playing football. You know, you play the ball for him, he play the ball back to you. Both of you run around. Those are physical exercises. Do it. You are sweating. Do it properly. You are running around in the compound with your child. You are playing football, throwing the ball. Those are physical exercises. Or you have a little gardening inside your compound. You have a garden. That gardening you are doing is physical activities. You bend down, you stand up, you are gardening, you are removing the weeds. Do it for 20, 30 minutes, an hour. You burn all those sweating. Just take your sugar reading before you start gardening and check your sugar reading after your gardening, and you see the difference. Your sugar reading is going to drop. Okay? Or you take a walk. Put your canvas and walk 1 kilometer and walk 1 kilometer back. Those are physical exercise. Instead of you driving to the market, walk to the market, walk to the shop, and walk back. Or if you have a school field that is near you, you can go to the field and jog around the field. Or you can walk around the field 20 times, 30 times. and sweat it off. Do it constantly. You see your weight and everything is going to change. Or if you have money, you cannot go and register in a gym and go to the gym and do a lot of exercise. Go to the treadmill and be on a treadmill for 20, 30 minutes and burn all those things out. So there are different exercises that you can do. So exercise is very important. Swimming is part of exercise. Yoga is part of exercise. Walking is part of exercise. Jumping, if you are jumping up and down, you jump, come down, you jump. Those are exercises that somebody might see you say, look at this man. Why is he jumping up, jumping up? He might be laughing at you. My friend, you are the person who knows why you are jumping. He doesn't know your illness. He might look at you, look at this man coming out and be jumping up and down, jumping out. Forget about the laughing, what they're talking about you. You are the only person that knows the reason why you are jumping in your compound. Okay? So there are different kinds of exercises that you can do that is going to help those medication you are taking to control your sugar level and to reduce your weight and to live and eat a balanced diet. So when you finish those exercises, you don't finish exercises and you go to a bar parlor and you start drinking alcohol. I see some men, they finish playing football, they finish doing exercise. The next thing you see them sitting down drinking Gouda, drinking Heineken. I say, look at, you just finished exercise and you go back to drinking alcohol. Or you just finished exercise, you go, your wife is leaving you a big pound of pounded yam on the table. No. Or a big bowl of rice on the table. No. You have to balance it with a healthy diet. Remember, you are diabetic. You're not supposed to be eating those big bowl of carbohydrate anymore. You got to eat it in a smaller portion. Your food must contain fruit, vegetables, 15 grams of carbohydrate, water, and protein. Instead of that meat, go for fish, salmon. There are all different kinds of fish that provide you that protein. Omega-3. Okay, you need it. And then take orange. The one slice of peel one orange and then take it. That provides you the superfood that you need, the fiber that you need, and stay away from orange juice. So there are a lot of exercises that you are going to do that is going to fit into your diet management. And one thing again, I'm going to tell to all women, all hot wives at home, all men, stay away from red palm oil. Stay away from red palm. I see when I travel to Africa, Nigeria, go to other countries, you see when they bring the soup, you see a lot of red oil in it. That oil kills a lot of men. That oil is why you are having cholesterol issue. That red palm oil contains a lot of cholesterol. In the Western world here, doctors preach against it. They will tell you stay away from red palm oil because it contains a lot of carbohydrate, and that is why you see some men have heart issues, cardiovascular issues. They have a lot of strokes, heart attack, because every day, every food they cook, there's red palm oil, and they don't even put it in a smaller quantity. You see them put a lot of red palm oil, and the man is keep pounding those red palm oil, and then you are building up a lot of lipid fat in your arteries. The next thing you're having a heart attack, you say, oh, I cannot breathe. The next thing you see you're breathing, you find it very difficult to breathe, or you can't even run. There are some men, as soon as they take 2 steps, they are tired. You see them breathing heavily because the kind of red palm oil they are taking that clog up the arteries that they cannot breathe. The next thing, they have heart attack. They have strokes because the blood is not flowing properly. The oxygen is not getting to the brain because the arteries have been clogged. The fat have narrowed the arteries because you are taking too much palm oil. And then even the worst thing, that even if you are eating food that contains palm oil, they are not even exercising to burn those fats out. There is one thing, you are consuming those red palm oil, but are you exercising enough to burn those fats out? That is why you have to be physically active, go to the field and burn those things out instead of adding weight. So exercise is very important in managing your diabetes. So you have to stay constantly exercising to get the adequate result. Okay, so this is the last topic for the daily diabetic essentials. Master the act of basis of type 2 diabetes. So friends, I'm going to leave you guys here now. We've been on this thing almost 3 hours now. So I'm going to meet you guys here back 5 p.m. my time, 5 p.m. New York time, So check your local time to know what time. That one we're going to have, that is the Diabetics Forum. In that particular forum is where I answer questions. I'm not discussing any topic. I'm answering all the questions that come in. So let's meet 5 p.m. today for another that diabetic forum to answer your questions. And then I believe this is okay for you guys. Okay. So I'm going to see you guys 5 p.m. today for Diabetics Forum. And then once again, I'm thanking you guys for today's program. So let's meet again and then stay blessed. Goodbye.